everyone. Welcome to another episode of the Two Idiots Podcast. I'm Reg.
I'm Randy.
And joining us this week, we have a distinguished guest, another person joining the show that's infinitely smarter and more well-educated than either of us, Mr. Davinder Singh.
Great. Thank you both for having me. I'm happy to be on the show and to talk to your listeners.
Awesome. Well, welcome here. So you are currently the medical officer of health for the Southeast region. Is that how it's described?
So I'm the medical officer of health for the Southern Health region. So Southern Health Santé Sud is the name of the regional health authority or organization that serves that portion of Manitoba.
Mm-hmm. Perfect. Okay. So within that role, what's your job? What do you do day to day?
So basically, I'm like a medical consultant for public health issues for the region. There's medical officers of health who are trained public health doctors who work at the national level, who work at the provincial level, and similar to me, who work at the regional level. Okay. And so, at the national level, they would look at things like national policies and national directions that public health would go in. In Manitoba, we have several medical officers of health who work for the province, and they, try to dictate where the policy around public health should go, and take the lead around certain programs like vaccine implementation.
Sure.
Mm-hmm. And then there's regional public health physicians like myself, and there's medical officers of health in all of the 5 different regions here in Manitoba. And we look at those policies that the national level and the provincial level have created guidelines on or talked about, and we try to implement it looking at the specific, uniqueness of the region that we work in, because things might need to be modified slightly to be able to accommodate, what's happening actually on the ground in that region.
Sure. No, that makes sense. Yeah. Really quickly, what inspired you to become a doctor, and how long have you been practicing?
So I probably was subliminally influenced by my parents because they're both physicians.
Or overtly.
My mother is a family doctor and my dad is an eye doctor. Okay. And so I have other, people who've gone into medicine in my family too. So I'm sure that was a major influence. But I always was, had a strong aptitude for math and science and things like that. I did all of my education here in Manitoba and, born and bred Winnipegger. So at the University of Winnipeg, I did a biology and biochemistry degree. And then I went and did medicine here at the University of Manitoba. And then, went through that 4-year program and then was lucky enough to match into public health and preventive medicine. I'm not sure if you're familiar with kind of how the medical kind of, system works for where people end up going. But once you're done in medical school, you kind of apply to all these different programs in whichever specialties you happen to be interested in. And then you interview for them. And the programs also interview a number of applicants, and a magic computer just matches you kind of where you rank the programs and they rank you. So I was fortunate enough to be matched into public health and preventive medicine here in Manitoba and did my training here.
Perfect.
It's kind of like doing one of those aptitude tests when you're in like high school and it's like, you're going to do this job.
Yeah.
Not quite. So in medical school, you have, your first 2 years are mainly classroom based, but you do a number of, firsthand, like hands-on exposures with different areas in medicine. And then in your 3rd year, you do basically what's called like a rotating, clinical year where you go into all the core areas. So, I did internal medicine. So that's basically all the hospital medicine outside of surgery, surgical medicine, anesthesia, family medicine, obstetrics and gynecology, all of those different core areas. And then after that 3rd year, you get a chance to do a bunch of different electives, whatever seem to kind of be more of interest to you. And you get a number of electives. Partway through that year is when you send out your applications to all the different specialties to see, where you might get interviews, and those specialties can either accept or not accept you for the interview, both here in Manitoba and across the country. And then you go do your interviews, you rank them, they rank you, and then you match. And then, go on to whatever specialty you end up being matched with.
Awesome.
Excellent.
Well, cool. Well, I'm glad you did all the schooling because I'm not going to, so someone has to. So before COVID, what would you say were like the main health concerns around in the Southeast, if there was anything that really jumped out at you?
So I actually just started in this position on March 30th of 2020. So
Okay.
before I was doing this position, I was actually working for the University of Manitoba, mostly in education on teaching medical students and medical residents about public health and preventive medicine.
Okay.
Oh,
So that was a significant amount of what I was doing. I also have a vaccine clinic where I vaccinate immunocompromised or soon to be immunocompromised people, because that is one group of people that just needs some special vaccine considerations and usually needs some vaccine recommendations above and beyond what the average person would need. And it's a really important group to get vaccinated.
right.
And then I also am doing law school part-time. So that's mostly on hold right now, but I was doing that pre-COVID.
Sure. Again, so with everything going on, I kind of wanted to get into it. Like we're not doctors, and we talk about things that we shouldn't talk about all the time, so we may as well talk about this. But I always like asking people whether they're involved in current in the politics or in any sort of system right now. But how would you say the Manitoba, as a province, has handled COVID? How we've succeeded? What we could have done better? Anything come to mind?
So I think that we've handled COVID quite well. I mean, at the start, you'll probably have noticed if you were following the numbers that we had on average, many fewer cases than the average province across Canada. There were some other areas that had really low numbers, like in the Northern Territories and out east in some of the eastern provinces. But on average, compared to most of the other provinces across Canada, we had a lower caseload. Part of this was through, just being fortunate that we weren't one of those international hub airports, where we didn't get as many travelers coming through Manitoba as others. And we had a little bit of a head start compared to some other provinces, like British Columbia, I think, had, one of the first cases, for example, and Ontario had some of the first cases. So we got to learn a little bit about what others were doing and try to implement those things that we learned from those experiences in Manitoba. So, we had some things that were really fortunate, but we also saw that Manitobans really pulled together and did a really great job of listening to what, Dr. Rusin was saying in the media briefings every day, and what public health and other systems were recommending for how to contain the virus. And we saw generally Manitobans did a really great job of implementing those guidelines. And, looking back on analyzing the effectiveness of things like social distancing and things like staying home when you're sick, and following the general isolation or quarantine recommendations from public health, those did have a really big impact on slowing down the virus. And we saw that in a number of countries around the world.
For sure.
Sure.
Yeah. And that being said, I feel like we're kind of a victim of our success in some way, because now the people that are skeptical or where they don't, either they think it's fake or they don't subscribe to whatever, the rules and such. Now they seem to think that, well, our cases are so low, we don't need any of this stuff. But there's a high likelihood that it is low because we followed the rules. So on that topic, I wanted to kind of touch on some of the COVID myths, I suppose, that are kind of floating around, and kind of get your perspective on them. In general, what do you think of masks?
Generally, I think of them as just a tool in the toolkit.
Of course.
They definitely do not replace any of the other public health recommendations.
For sure.
So, having a mask will not replace the need to be at least 6 feet or 2 meters away from people generally when you can. It doesn't replace using hand hygiene, washing your hands, using hand sanitizer, that kind of thing. It definitely does not replace staying home when you're sick, or following getting tested if you meet kind of the COVID screening checklist for the symptoms,
Yeah.
or
Right.
following public health guidelines for case and contact management. However, it's possible that if you were doing everything right, there's still a period of about 48 hours before you start feeling symptoms where you could transmit the virus,
Yeah.
where we call it infectious or communicable. And it's possible that the mask could help prevent some of the droplets that you breathe from going further than they otherwise might have been. So it's possible that by wearing the mask, you could help prevent others from getting sick. On the receiving end, because most of the masks that people wear are generally called non-medical masks, or masks that aren't being used for specifically for health professionals, we can't know the quality of how well it would prevent someone from actually getting the virus, from preventing droplets from coming in. So we generally wouldn't say that it necessarily would protect someone from breathing in the virus if they were exposed. But we mainly hope that it prevents the droplets that someone's breathing out from going further.
Sure.
And I think that's the point that a lot of people miss, is they go to the fact that, well, it's not going to help me not get it anyway, when that's really not the point. They kind of said from the beginning that this is to contain the spread, not to keep anyone from getting it.
Exactly. It's to protect, your friends, your family, your children, your parents, your grandparents. It's to protect your community. And so if not only you do it, but if other people do it too, then that does protect you, because because by them wearing it, then hopefully their droplets aren't going as far when you're going out and interacting with people as well.
Right. I think we need to view it more as like a common courtesy than anything, right?
Yeah. I mean, that should be
exactly.
for all of this. That's the whole point, right? Is just to protect each other. It's not even just about yourself, nor should it be. But we need to be conscientious and be considerate.
For sure. I did have a question. Do you think that, and I've talked to a few coworkers about this, with the increased sanitation and kids in school using sanitizers and masks and all this stuff, do you think we may see an increase in other illnesses other than COVID just due to the very clean, sterile environments we're now going to be in?
Generally, I wouldn't say so. I would say we would actually likely see less illnesses overall. And the reason I say that is just looking at what the Southern Hemisphere has experienced. So, our summer is their winter. So they've just gone through kind of the regular flu season or respiratory virus season, and they noticed a substantial drop in infections from all respiratory viruses. They didn't really get a typical flu season. On average, they probably had about 10% of the number of infections that they normally would record. So nice. I'm really hoping that we see that in Manitoba and across the rest of the Northern Hemisphere, not counting on it or not planning for it, still planning to, try to prevent as many infections, especially with influenza, with, the traditional ways like getting vaccinated and following all the other same public health recommendations as usual. But I really hope that we see the same experience that they did in South America and potentially avoid a lot of other, respiratory infections by having the same precautions as we're using for COVID.
For sure. I love that. It's weird to think that, hey, if we're a little bit cleaner, things might, might keep things, might keep things good. Strange. Who would have thought?
Yeah, and we see that, with many other things. Like, we see that with sanitation in general, with foodborne illnesses and the inspection process and the cleanliness and sanitation that we have in our food system, that has saved countless numbers of infections and diseases. And so, it's the same principle for respiratory infections in our current environment, is that by having these public health measures and these sanitary measures in place, that they in general just prevent a number of infections and diseases.
For sure. Right. No, that's great. And also, you mentioned it earlier about vaccinations, and that you work pretty hand in hand with that. So of course, as always on the internet, there's endless number of people on either side of anything and arguing that that either they're unsafe or that, they're going to force it on us or we're getting microchipped or whatever, whatever thing. How do you personally react to that? And, I imagine you're for vaccines.
Yeah, of course, I'm, slightly biased just being in the field that I am.
Of course.
But I'm also, knowledgeable about just the general literature around vaccines in general. And I would categorize vaccines as one of the most remarkable inventions that we have ever come out with.
100%,
so if you look at most vaccines, they work, around between 90 to 99.9% effective. And it depends what vaccine you're looking at as to how effective it is. And so we've basically eradicated things from Canada and North America like measles and polio, and dramatically reduced things like pertussis or whooping cough, all of those kinds of diseases. They still exist in some countries and can get brought in, usually through travel, but we've basically gotten rid of them from the usual circulation in North America. We've all but eradicated smallpox, except for being in some labs around the world. And then, we have other vaccines that aren't as effective, like the flu vaccine, but it works anywhere between usually 30 to 70% effective. So on average, I would say 50%.
Yeah.
And, it not only could prevent someone from getting an infection, but it could just reduce the severity of the infection. So, just because you might have some flu-like symptoms or a runny nose or a cough or something like that after getting the vaccine, there's two important things to consider. One, there's about 12 different respiratory viruses that are circulating during flu season. So there's other things like there's viruses called like RSV or human metapneumovirus, adenovirus. There's a bunch of them. And so it could be any one of those viruses too, which the vaccine isn't meant to protect against, but generally aren't as severe as influenza. Or it could be that you did get exposed to influenza and it did cause an infection, but that the infection was milder than it otherwise would have been. And, I've seen and heard about people that have been completely healthy, no underlying medical conditions, that have ended up in the intensive care unit just from influenza. Right. And on average in Canada, about 3,500 to 4,000 people die every year from influenza. So, there's a reason why we have the vaccine, and it's extremely important. And I personally get it every year. Vaccines in general, I think, are a remarkable invention. As far as the COVID vaccine, I think that, we do have very robust safety systems in place to make sure that these vaccines are extremely safe. So before any vaccine would be allowed to be used in this country, it would have to be proven to be safe.
Of course.
And we can see that from things like one of the vaccine trials that's done through Oxford University and in conjunction with the company AstraZeneca was stopped briefly because there was one person who seemed to have an unusual reaction, and they completely stopped the trial to investigate to make sure that they knew what was going on, found out that it was safe to continue, and then restarted that trial.
Right.
And the way that vaccines are generally approved is that there's 3 different phases once it's allowed to be started into use with people. So before it's even allowed to be started to use with people, there's a whole bunch of basic science work that goes in and animal studies that go into making sure that there's no indicators of the vaccine being unsafe there.
Sure.
Then it starts with a very small number of people. It's called a phase 1 trial. Usually it's anywhere between 10 and 30 people. And they're looking mostly at safety. Then there's something called a phase 2 trial, generally 1 to 300 people. And they're looking both at safety and at different doses that might be effective. So they're looking for, what is the lowest dose that creates the effect on the immune system that we're hoping for to prevent infections.
Of course.
And then now there's 9 different vaccine companies and 9 different vaccines that are at phase 3, which is the final phase before a vaccine could be introduced. And then there's tens of thousands of people per vaccine that would be involved in that trial, and they're looking for safety. They're looking for rare, effects that could be caused by the vaccine to make sure that it is safe before it would get introduced. And then after a vaccine's introduced, there's something called after-marketing surveillance, or sometimes it's called phase 4, where they're also getting all the information from the real world, from people receiving vaccines, to see if there's something even more rare around the 1 in a million or 1 in 10 million mark, to make sure that they're not missing anything. So, our vaccine regulatory system is extremely robust and extremely safe.
Awesome. Well, that's good. Great. I mean, I expected nothing less, and that's why when whatever quote unquote conspiracy theories or things like that start bubbling up, I tend to side on, or I tend to lean towards, that the systems are in place and that we've have decades and decades of experience with this and measures in place and rules and such. I wonder, I've heard anecdotes about in the mid 50s when polio was rampant, or was it early 50s? Basically, the uptick or the usage of the vaccines were fairly low among the general population in the U.S. at least, until Elvis Presley himself apparently got a polio vaccine, and basically it went viral, whatever that means, in the 50s, and suddenly it jumped up to, I think it was like 80% usage or something. I wonder if we need something like, maybe some sort of pop culture, as sad as it is that we need, some sort of, influencer to convince us of this. But I wonder if that's something that we need. And if not, how, whether in your office or in general, how do you guys normally go about trying to convince people to do anything? Like,
the promotion side of it. Yeah.
Yeah. And how do you manage that to try and get people to follow any rules?
I think the main thing that, we try to do with any intervention or any public health kind of message that we're trying to get out is just around education. First, the main reason that people might be fearful of something or, be concerned is just either a lack of education, or like a lack of information, or, misinformation that they may have heard that they haven't heard the other side. And so, there are some things that also seem a little bit counterintuitive, that when you first hear it, it sounds concerning, but then if it gets explained a little bit more, then it makes sense. So I'll give you one example. So, when there might be a new case of mumps, and if there's a mumps outbreak, for example, at first, more people who have been vaccinated might get the infection than people who are unvaccinated. And that sounds weird, right?
Yeah.
But it's because so many people are vaccinated that the percentage of people who are exposed and are vaccinated that get the infection is way lower. Much right. Lower. But if you have 80 or 90% of your population vaccinated and that many people are exposed, then overall the numbers might be higher for the number of people that are vaccinated and get an infection, because only 10% of people aren't vaccinated, let's say. And only a portion of them will get exposed, but their percentage of getting the infection, if they are exposed, might be way higher. So there's like little pieces of information like that seem, odd or counterintuitive and might make someone question whether or not they should get the vaccine. But then if you get down to really the details of it, the vaccine for mumps is, extremely protective, and your likelihood of getting an infection if you're lower than if you didn't get the vaccine. So,
right.
I think a lot of the hesitancy around vaccines and, a lot of the fear is just from, not having the complete picture and not having someone that's maybe, gone through some of those fears or some of the concern and try to, explain why that might be.
For sure.
It's easy to make numbers misleading, right? You could say, 500 vaccinated people, got the mumps or whatever, right? But that could be out of 200,000. And you could say, 50 unvaccinated got it, and that's out of 100, right? But it's easy to spin the headlines whatever way you want.
Yeah, that's
exactly.
a good segue, actually.
So when we're trying to get the messages out, one, you want something that gets out to as many people as possible and is very, simple, straightforward, and has a clear message. And then two, when you do have a group of people that is more hesitant, or that's harder to reach, then some outreach specifically to that group of people. Maybe it's through town halls, maybe it's through more fact sheets, maybe it's through some other more detailed mechanism like that then you can try to get a more specific message to those people, because they might be harder to reach for whatever reason.
Right. For sure. No, I love that. As I was going to say, it's a good segue into what I was thinking. Like, we're running low on time, so I wanted to do two things. One, I've heard that with herd immunity, it was brought up a lot at the beginning of COVID, and how effective that is. I've read some things that basically said that in order for herd immunity to be a thing, we'd need to infect something like 60 or 70 or 80% of the population without a vaccination. And so first of all, let's touch on that. Is that true? And also, extended to that, do you think social media has been overall good or more toxic for these types of discussions?
So I'll touch on first the herd immunity question. There's a formula or equation that we generally use, and so because one of the elements of that equation isn't definitively known, I couldn't give you an exact number. Sure. But I'm not sure if you were following kind of some of the discussion earlier around a term called R0 or R0.
Yep.
And
yep.
It refers to approximately how many people will how many people one person who's infected will go on to infect for how fast it spreads. So the R0 or R0 for the coronavirus that causes COVID-19, was estimated to have, was estimated to be anywhere from 2 to 5. And, there's been different estimates at different times. It's probably more like somewhere from 3 to 5, but I couldn't give you an exact number because Sure. There's still some uncertainty about the transmission or infectiousness of the virus. Mm-hmm. And so the way that we try to figure out how many people need to be immune in order to develop herd immunity is just an equation that's 1 minus 1 over R0. And so the higher R0, or the more people that can that an infected person who's in a susceptible population can spread the virus to, the larger the herd immunity number needs to be.
Of course.
So I'll just use some simple numbers. If it's if R0 is 3, then it's 1 minus a third. So it's about 66% of people would approximately need to be immune to develop effective herd immunity, where you kind of create pockets or bubbles of people who are immune, where you have an infected person, but then they come into contact with so many immune people that it doesn't spread very quickly.
Sure.
Gotcha.
If you have something that's more transmissible, like one of the most infectious diseases that we know of is measles, and it's got an R0 of somewhere between 12 and 18. So about 95% or so of the population needs to be vaccinated in order for it to be effective. That if someone does happen to get measles, and usually through travel and brings it in, that they won't spread it, because so many people are immune that it won't go anywhere, essentially.
Right.
Sure.
So I can't give you an exact number, but if you think about the R0 being somewhere between 3 and 5, then you can kind of figure out approximately how many people would need to be immune to develop an effective herd immunity.
Well, and the problem with that is, again, it was running rampant to my other point there, basically on social media, but people are like, well, let's just let everybody get it, protect the vulnerable, and we get herd immunity.
A lot of people pointed to Sweden and how they didn't really do a lockdown. They just sort of put the seniors away and anyone who was immunocompromised.
Which I've heard some discussion on whether or not that was effective. But but basically, depending on the mortality rate, if you're willing to infect even if it is, say, 50% of the population, how many people are you willing to let die just to hopefully gain immunity both out of vaccination? Then what?
Yeah, exactly. And I mean, even really low estimates for populations that are, really robust to the virus, like mostly when we talk about children or younger people that don't have chronic diseases like hypertension or diabetes or other things like that, then even for estimates like with that population, even if it's 1 in 100,000, then that's still, a lot of people that if all of them were infected, that's a lot of people that end up dying from the virus. And that's only one element of it. That doesn't take into account how many people go to the hospital, end up in the ICU, but don't end up dying. But that's still, a significant disease, not only for the person, but also, the system impacts of having that many people need that level of health system resources.
Mm-hmm.
And if you ever get to a situation like they had in Italy, where the health system is overwhelmed, then that completely changes the equation, because if you don't have enough intensive care unit beds, or you don't have enough healthcare system resources, then the mortality rate actually increases, because people that might otherwise have done well might not do as well, because they don't have the health resources to devote to them.
Yeah.
So, that's it ends up being a lot more difficult than it sounds, initially around, even those populations that have a really low mortality rate. The impact of everyone getting infected is quite dramatic.
Yeah.
And you referenced Sweden, and if we just look at Sweden, even their own government and their own health minister has said that if they could go back, they would do things differently. Right. So, even them in their own post-analysis of their own strategy has said that, their strategy wasn't the best one, and that they would have gone back and implemented more strict public health measures if they could go back in time.
Mm-hmm. Sure. My friend in Finland, they have a natural hatred for Swedes for some reason. I don't quite understand the history, but he basically, he just alluded to the fact that, stupid Sweden, but that's neither here nor there. But as I said, like I said, we're basically running out of time with you here, unfortunately. We could go way longer, but like I said, as a rule, or as a whole, do you think social media is good or bad to try to handle this or get the messaging out?
I might not be the best person to ask, because I don't use social media very much, specifically in my own, personal life. And I think of social media again as like a tool. So, it really depends on who's using the tool as to, what its effects will be. Social media has done really, dramatic things in terms of being able to get messages out there. So if you have a positive message that you want people to hear, then social media does have a lot of, ability to get that message out. And you mentioned earlier around influencers that, having influencers might be something that is required in order to get, more active engagement around use of public health measures, use of masks, getting vaccinated, things like that. But on the flip side, it's also very easy to spread misinformation.
Yeah.
And we've seen kind of the weaponization of misinformation at different levels, at government levels for influencing elections, and at other more personal levels for influencing individuals, people's behavior in other domains. So it's tough to really say one way or the other. It's mostly just a tool.
Mm-hmm. Yeah, for sure. I also just noticed that we've been recording this episode, and I've been looking at the monitor, not at the actual camera. So I didn't. That'll come with practice. But I think you're totally right. I think social media, in many ways, is excellent and great for what you can use it for. But yeah, it has kind of been weaponized in many ways that are toxic and dangerous.
I did sort of have one quick question before we let you go. We talked earlier about the effectiveness of flu vaccines and how it's hard to judge because you don't really know what strains of the flu are going to hit that year. Now, in terms of developing a COVID vaccine, do you think it's going to be more effective as a vaccine because we're more focused on one strain of this virus? I don't know how much it may have been mutated. I haven't looked at the studies, but do you think it'll be a more focused vaccine because we kind of know what it is and what we can fight?
From the very early information that I've seen, and there hasn't been a lot published, so I can't comment a lot about, some of the the later information around many of the vaccines. And also, I believe I've only seen published data for 3 of the vaccines. So, there's 9 currently in phase 3, and there were, I think, 32 in clinical human trials the last time I looked. So, that's a very small number out of all of the vaccine candidates that are out there. But the strategy that I've seen being used is looking at more of a common target for this coronavirus, so that even if there are some small changes in the virus, that doesn't necessarily mean that the vaccine won't work, because it's looking at more of a common target that won't change as much. And so that's kind of one area. But also the second thing is that some of the vaccines are looking to boost kind of a more general area in the immune system that has a broader effectiveness on viruses in general. So so they're looking at some more general areas, so that even if there are slight changes, that it doesn't necessarily mean that the virus will be able to evade kind of the immunity that the vaccine is hoping to develop. So that's the strategy that I've generally been seeing from the information that I've looked at. But but I can't say for sure, depending on what the other kind of 29 candidates that are in clinical human trials are doing, and 2, just how the later stages of the vaccine trials are going.
For sure. Awesome. Well, first of all, thank you for doing the job that you do, and trying to educate dummies like us and other people to kind of keep us all safe and work towards, I guess, past COVID. So thank you for that. Also, thank you for joining us. Is there any, you said you didn't use social media, but is there any websites or any sort of resources you'd like to plug before we let you go?
Yeah, definitely. So first, I'd like to thank you both for having me, because I think that, getting out the correct information and just getting out more information about how people can protect themselves is useful in all its various ways that we're able to get that information out. So thank you very much. Also, you thanked me, but it's not just me. I work with a huge team of public health professionals, and really it's no one person, but it's the whole team that's really pulled together and is responsible for trying to keep Manitobans safe. And I would just like to recommend that people go to the Government of Manitoba COVID website for kind of the latest updates, or for looking at what symptoms to look for screening. So if you're wondering, whether or not you should go to work someday, or you should go to school, just to look at kind of the screening symptom checklist to see if there's anything on there that means that you shouldn't be going into work that day, shouldn't be going into school that day. Most people would think it's pretty intuitive, like if you have a cough or you have a sore throat, things like that. But just it's always worth going to look at the list just to see. And if it is indicated that you have something on the list that means that you should go for testing, then to go and get tested to see if it's the coronavirus or if it's something else. Because that could also impact how long you should stay at home for, either more or less time. And also the Public Health Agency of Canada website is really good for information from around Canada, and for guidelines that are developed at the national level. So I would just recommend those 2 websites.
Amazing.
Perfect.
Awesome. Cool. Well, again, we don't want to monopolize too much of your time. We've probably already gone too long. But I think there's a lot here, and I would very much like to chat with you again in the future.
For sure.
And you're right. It isn't just a one-man thing. So thank you to you, your team, all the health professionals, all the people trying to, spread the good word, and let it get us to work through this.
Great. Thanks again. And yeah, I'd be happy to come back on the show anytime. So
awesome.
Take care.
That'd be amazing.
Thank you very
Cheers.
much.
Have a good day. Well, that
was a good chat.
That was interesting.
Fun.
I enjoyed that. Because again, we are a couple of dumb idiots, and which shouldn't be news to anybody, and nor is it. So I appreciate always talking with people smarter than us, which is kind of the goal, because mostly everybody is smarter than us.
And like we said, it's to help get the word out to people, right? That's kind of the biggest thing is, the government isn't out trying to get you all the time.
Not all the time. Sometimes.
You know, and what we have to do, and I talked about this with my mom the other day, was that because she had to go for a test herself because she was, I don't know, she's in contact with somebody who was in a public health area, whatever.
Yeah.
And I've done the test myself. My daughter's done it now. We should normalize going for a test, right?
Sure.
Because she texted me saying, "Oh, I hope no one sees me while I'm waiting in line to get this test done," right? And it's like, well, you know, it doesn't have to be that way. Like, we all should be going to get it and wanting to get it because we should want to know. And it shouldn't be, you know, you shouldn't be shamed or looked at differently because you're being proactive and going for a test.
It's just like anything. Like if you, like I keep saying with anything, we always talk about with mental health, but just in general, like if you break your ankle, no one's going to judge you for going to the doctor. So what's the difference? If you think you have a test or you think you may have the virus, whatever, you get the test. There shouldn't be any shame. I'm not going to judge anybody for sitting there.
No.
Like, again, I've gone through to it too. I didn't feel embarrassed that I was there.
If anything, it should be looked at as being proactive and, you know, protecting your friends and family and community and doing your part, right?
Yeah, and it shouldn't have to be said, but we live in a community that is predominantly Christian claiming, which is, in my humble opinion, meant to promote community and loving your neighbor and being a good person and helping those that need it. So if you claim to be that while also scoffing at public health orders, for no reason other than to say, you can't tell me what to do. Yeah. It's like, well,
it's
then,
my right.
Yeah, maybe you should rethink how you're dealing with things.
For sure.
And basically it's just, the government's too stupid to come after you. Like, you know what I mean? Like, how much, if you have so little faith in them that you think that they're actively coming after you, you maybe need to think about the fact that they mostly suck at most things. Yeah. So if they were actively trying to control us, whatever that means, please, somebody tell me, what does that mean when they're like, oh, it's just the system of control getting us to wear a mask?
Yeah.
For
because if
what?
they can get us to wear a mask, they can get us to do whatever they want us to do. Right?
Yeah, see, that's not how that works. But even when they're talking about vaccinations and, they're putting a microchip to track you and you know, they can't force you to do that. They don't have to do any of that. They already have your name, your social insurance number, your license plate, your phone. The government has everything they might ever need that isn't embedded in your nano whatever the fuck.
They're gonna get you.
It's such a bananas thing.
Yeah. Look, the fact that you people are, you know, you're talking about it on Facebook, on Instagram.
Did you just say you people?
Yeah, I did just say you people. You damn people. But I mean, myself too. I'm on Facebook. I'm on Instagram. They have all your information already.
Yep.
No matter what, right? You can bitch Facebook can't use my photos for blah, blah, blah. They've got it all. It doesn't matter. You clicked I agree without reading shit.
Yep.
They got everything.
Oh, they
Doesn't
have it.
Matter.
Google your name. If guaranteed, the first pictures will be from your Facebook feed that you don't ever remember giving permission for. So, yeah, privacy sucks. The government's not great, but they're not evil. Not here, at least. They're not explicitly evil. I don't know. It's silly.
Very much so.
But anyways, big thank you to Dr. Davinder Singh for joining us. A couple of humble morons
A couple of schlubs.
Yep, preach the gospel, spread the good word. Again, it was a fun discussion, and I think there's something there. And again, most people might not take it seriously or personally, or they'll just chalk it up to the usual narrative and that blah, 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 whatever. But I'm glad that we talked to him and we got that out there. I wonder, should we have a few minutes? We haven't hit an hour yet. Should we chat about some random goofy stuff or what?
Man. What do you want to hit on?
First off, rest in peace, Ruth Bader Ginsburg.
Yeah.
We should touch on that.
RBG.
Yep. Notorious RBG. And this episode won't drop for a couple weeks yet, so this will already be stale.
Right.
But, yeah, it's really sad. And the fact that the U.S. will now have a very overt conservative lean on their Supreme Court is a bit daunting and a bit alarming. But, yeah, not that necessarily affects us, but it could because...
No, but we're going to hear a lot about it.
We will. And especially because, we're going to go into a little bit, especially because in 2016, when Obama was on his way out, or 2015, I guess technically,
Right.
when he was on his way out, I forget which justice died or retired or left the bench, and the Republican, Mitch McConnell, head of the Senate, would not let Obama nominate a judge because he
Right.
was a lame duck president and he was going out of office.
Right.
They're like, you can't do that. Even though now, before Ruth Bader Ginsburg's body's even cold, Mitch McConnell and the Republicans are now saying, well, we're going to do it now. And Trump released a tweet saying we need to do it with all haste and we're going to do it immediately. Right. It's like, so he's a Democrat and now that's a rule that you can't do when he's 237 days before he left office.
Right.
Or sorry, before the election.
No, we are well within that mark now.
5 days or something, 43 days or whatever it is. And again, as of recording. And so they're going to turn around and do it just to stack the deck.
Right.
It's fucking dirty, man. I tell you.
It is. Politics is dirty, man.
Yep. Are you going to get the COVID vaccine, Randy?
Probably.
Or is the government going to have to break into your house, jam you in the arm, insert the little robots?
You'll never take me alive. Honestly, probably. If they put the studies out, I'll probably read about them and do my research on it for sure.
Yep.
But I mean, I get the flu shot every year, so I can't really say much. I mean, I have asthma. Yeah. I don't want to get COVID because if you got bad lungs, it sounds pretty fucking bad for you.
Yeah, a little bit.
Yeah. So, I mean, I get the flu shot to protect not only myself, but now my kid, right? She doesn't have the immune system I do. And my dad, who's elderly, right? He's creeping up to 80. So,
man, he's so old.
I know, right?
Oh, Fred. Hasn't aged a day since 2005.
We should get him on one day.
I would love it. It would just be an hour of silence.
Pretty much.
Just, how's it going, Fred? Good?
Good. It'd be him asking us to repeat ourselves about 30 times.
Oh, my God. Yeah. What was that? Yeah. But otherwise in the world, Tampa Bay and Dallas are playing for the Stanley Cup. I'm rooting for Dallas, even though on paper I think Tampa should win.
Mm-hmm.
So again,
I see Dallas win, just kind of like Tampa.
Yeah, well, that's interesting.
Yeah. Will you get the vaccine, Reg?
Yes. Yeah. Again, if it gets released like a flu vaccine, I don't have any concerns about the safety or efficacy of that.
Mm-hmm.
Again, people will release whatever proof that quote unquote whatever that is, that vaccines are unsafe or there's this, that, and the other thing. And to be honest, it's like 1 in, what is it? I've looked at the stats or something. Whoops. It's like 1 in 3,000 vaccinations or more or something like that might have a negative reaction.
Mm-hmm.
And yeah, some people have been affected poorly, but overall, that's
the benefits far outweigh the risks.
Exactly,
for sure.
Exactly. So 100%, if it comes out and it's been safely assumed to be, or safely proven to be safe,
right?
Yeah, why wouldn't I?
Mm-hmm. For sure.
Whatever.
But yeah, I mean, other news: NFL Week 2 is kicking off today. Kicked off on Thursday, I guess. But
yeah, I haven't actually paid attention to any of that.
I actually watched a few games last week for the first time in a while. Since there's no CFL going, I'm just watching NFL because it's football.
That's fair.
But see how Tom Brady does in week 2. Maybe better than week 1. Who knows?
Yeah, because he lost. Oh,
the Tampa legacy continues.
My dad is calling me. Should we get him on the show? No, we won't. Talk to you later, Dad. Yeah. Anyway, this doesn't have to be super long. This is kind of the first one we're recording, so we'll see. I mean, we're gonna have other ones released first, but this might show up on YouTube.
Maybe.
Folks. So
maybe you're gonna see our Liga Mugs on YouTube.
We have a YouTube channel. Basically, just search the 2 Idiots Podcast.
I'm gonna have to do something about these bags if we're gonna start videoing full time.
Right? Yeah. Get some stuff. My wife has like $800,000 worth of like face creams and stuff. So, I should probably start using some of that. She's like, well, you should use this. I told her, I was like, you get me one thing to use, and I'll use it.
Mm-hmm.
But she's like, well, you should get this cream and that
a
cream,
cleanser, and then a toner, and then a de-scrubber,
and
then
a detoxifier, and whatever, an extruder, and
exfoliator.
And all this other goofy crap. And find me one thing, even if it encompasses one or more of those things, I'll use it.
Yeah.
But
props to people who do have a full skincare routine. Sure, because you're all glowing, but I don't got the patience for it.
Yeah, I don't want to. I'm super. I barely even put hand lotion on. My hands are
The
cracked and
most
dry.
I do is I have like a beard conditioner that I use, and I just rub it all over my face. It goes in the beard because I get terribly dry skin right under my facial hair and everything. So it just goes on the beard, and then it goes in the hair, it goes on the eyebrows, it goes everywhere.
I always wondered why your face looked so nice.
I know,
nice
right?
and clean. Yeah, I've been hashtag blessed. But I've never had to deal with like acne, or all I have now is dry skin.
Right.
A little bit of eczema.
Psoriasis.
Susan thinks my psoriasis is sexy. But yeah, so I've never really felt the need, and yeah, I look like I'm 45, but I don't care that much.
No.
But yeah, now that we are going to be on YouTube, maybe we should pretty ourselves up a little bit.
Maybe.
You can see us in the flesh. In the flesh.
Anyone who's never seen me before, realizes how ginger my beard is.
See how red that is?
So orange.
It's nice. It's on fire.
Fire.
Fire. Forever on fire.
Call 911.
But yeah, so definitely check us out, the Two Idiots Podcast on YouTube. Go to Instagram, as always, Two Idiots Podcast. On Facebook, Two Idiots Podcast. And on Twitter, Two Idiots Show.
And by email, doubleidiotspodcast@gmail.com.
Yeah. And be sure to subscribe to this video. Maybe I'll try
Do
that
it.
little
Are we
thing
gonna-
where
are
it
we gonna
pops
try a
up.
pointy thing?
Yeah, right
Right
there.
there?
It's going to pop up right there somewhere.
Right there.
Or it won't. We'll see.
This general area.
Yeah, somewhere there. Check that out. And be sure to subscribe to Apple Podcasts, follow on Spotify. Just get your hit.
Yeah. Rate, subscribe, do all that fun stuff. 5 stars.
Exactly.
5 stars.
5
stars. 5 times. 5 times.
But yeah, so thank you for joining us. I hope that you may have learned something, or maybe you found something to make you angry. I don't know. It doesn't matter.
Hope it made you feel something.
Exactly. That's all we want. It's
Just the feeling. That's all
We just want
need.
you to feel something. It's all I ever want, Randy. But we have some fun episodes in the tank coming up over the next few weeks. Some real exciting stuff.
Get ready.
So, yeah. Follow, rate, subscribe, all that stuff. And we are going to leave you like that and call it a day.
Goodbye.
Goodbye.